Doctors in hospitals across the country, including here in Oklahoma, said they're seeing a dramatic rise in cases of RSV. This is not a new virus. This is one that's been around for a while, and most children will contract the virus by the age of 2. But right now, cases are surging. This afternoon, pediatrician Courtney Sauls is here to discuss what parents need to know. Courtney, thank you for being here as always.
Hi. Thank you. Happy to be here.
First of all, what is RSV and what are the main symptoms?
Yeah, RSV is an upper respiratory virus that starts in the nose, travels down the throat to the lungs, and really affects our youngest babies the most, causing them to have a mucus buildup in their lungs that has a hard time getting out, and those developing lungs have a lot of issues with cough and congestion, and then worsening into respiratory distress for our littlest babies.
Now, what can parents do at home?
Yeah, so there's not a whole lot of treatments for RSV. There's been a lot of studies of different kinds of things to treat it, but the best thing for children can be using some nasal saline squirts in the nose, followed by sucking those boogers out, and then using a humidifier to help with some steam, and then making sure your babies and children are staying hydrated with plenty of fluids.
Now, you mentioned during the break that, kids going back to school, older siblings coming home with, whatever, and that's what's, kind of leading to this. Anything parents can really specifically look out for?
Yeah, so in your older kiddos, it's going to seem like just an annoying cold, but in those young babies, it can get pretty severe quickly. And on usually the 5th to 7th days of the illness, babies can have a hard time breathing, where they're breathing very fast, using their extra muscles of their ribs to suck in their bellies, and even flaring their nose in and out and grunting while they breathe. And those are all signs that you should get your baby checked out with their doctor or even in the emergency department.
Now, as someone who works in a hospital, are you seeing this increase like everybody else is talking about?
Yeah, in Oklahoma, cases of RSV have even increased double-fold in the last week or so. Our pediatric hospitals in both Tulsa and Oklahoma City are full to the brim of children suffering from these respiratory illnesses. So it's definitely on the rise, which is a bit unusual for the season right now.
Now, there's symptoms to look out for. Parents can look out for certain things, but when should you know that it's time to go to the hospital?
Yeah, certainly if you're seeing a blue discoloration around the lips or the mouth in your baby, they're lethargic, that they won't eat or drink, and they're breathing so rapidly, they're using those extra muscles, about 60 or 70 breaths in 1 minute, that's way too fast, and I want them to get checked out by a doctor ASAP, probably in the emergency department.
Now, you said that during the break that there's complications, even though that you guys are able to treat this. How are you able to treat that, and why is it so important to get to the hospital when you see those signs?
Exactly. Babies can develop a secondary pneumonia or can get low oxygen levels where they can't get enough oxygen to their body. And so the treatments for that is going to be oxygen given in the hospital, and oftentimes they need extra fluids to help keep their blood pressure up and keep their body hydrated. But really, oxygen is going to be your big key in getting those lungs aerated really well.
Some very important information. Courtney, thank you as always for being here.
You're welcome.
Well, still